Hey everybody, I'm your four-eyed professor, Chris Lievens, and I'm super excited to talk to you today. Our roll call is for new and experienced ODs, optometry students, and even those just interested in this profession. We'll cover a number of topics together, and I'll help you see them through a professor's eyes. Please take your seats. School's in session. Hey everybody, welcome back to the Four-Eyed Professor podcast. We have a hot topic today. We're diving back into the pool of presbyopia, which by the way is no fun, but on the R&D side and on the deliverables to the market today, very exciting because we're going to be talking about the newest entry into the pharmacologic treatment for this condition. And for that, I am welcoming to the podcast Dr. Janelle Davison. Janelle, thanks for joining us.
Hey, how are you?
I am A-OK. So before we even dive into this topic, since this is the first time I've had you on this podcast, please tell everybody about yourself.
So yes, I've been practicing just shy of 20 years. So it's my 19th year. I practice in a private practice setting, which I started cold about 15 years ago. My main office is a full scope primary care office. And within that office, I offer glasses, contact lenses, high-end progressives, digital lenses. We also do stay abreast of new technology where we also offer therapeutic options for presbyopia, non-surgical lid lifts. And then we used to do a lot of dry eye, which that's my thing. I call myself the dry eye mentor. And so I took that portion out, dry eye aesthetics and kind of anti-aging, and has its own dedicated space. So I'm toggling throughout the week right now, kind of wearing multiple hats, but I enjoy it.
Well, it sounds like you see a lot of patients, Dr. Davison, and I imagine you see a lot of presbyopes too.
Yes, I do. And this year I became presbyopic. So not only do I get to treat these patients, but I'm experiencing this with them. And so it's an exciting time to have therapeutic options, not just your traditional glasses and contact lenses. I jokingly tell my patients that this is not our parents' or our grandparents' presbyopia. We have options available through innovation.
Yeah, we really do. I mean, that's kind of what's making this space so exciting. And from the patient perspective, not just the prescriber perspective, it's needed. So for any people listening who are not yet presbyopic, I remember before becoming presbyopic as a patient, and I didn't know what my patients were all complaining about. I was like, just take your bifocals and get out of my office. Why are you complaining so much? Until it happened to me. And so it's no fun. When you look and you just can't see anymore, there's this aura of aging in the back of your mind, and it's frustrating. And so to have something now that's newfound beyond glasses and contacts, it really gives us tremendous opportunity.
I agree.
So the topic of today's talk is performance, because we have, if no matter the treatment, if it doesn't perform, no one's going to use it. So performance is key. Convenience is also key. And another key word here is customization. So what do those three themes mean to you with regards to the drug that we're talking about, Qlosi, Qlosi?
And so those words mean a lot. This space has been innovated before. There was one that came to the market before, and I've prescribed that. I like to tell patients and listeners that I'm about innovation. So I prescribe and I use things that come out and I think that fit well into my practice. But I like that this new medication is the lowest concentration of a miotic, which is important. We have something that entered the space before. We have new things coming. I tell my patients that that's not a bad thing. The more we broaden this space, the more knowledge and awareness we bring to this condition that millions suffer with. So it's the lowest concentration of a miotic, which is important. And then we'll probably get into a little bit more how I really like the formulation of this Qlosi EyeQ formulation.
Yeah, let's go there. So the miotic that we're talking about is pilocarpine, correct?
Yes.
And of course, pilocarpine, we've had over 100 years of experience with. The majority of those years were in the glaucoma space, relieving intraocular pressure. But correct me if I'm wrong, that those concentrations were significantly higher than what we're talking about with regards to presbyopia. Is that right?
Yes, that's when I talk to my peers to kind of orient them where we are. So yes, we've used pilocarpine before in the glaucoma space, but we were looking more like 2%, 4%. And
Right.
so we don't need those levels of percentage, which we learned through research to be able to give that miotic effect to be able to improve presbyopia. So specifically Qlosi, which makes it different than some other pilocarpine based miotics on the market, is that it's 0.4%, which is the lowest concentration of pilocarpine or miotic that we're using to be able to give that pinhole effect.
So let's go there then. This pinhole effect. So being very purposeful with a very specific concentration that you mentioned, 0.4%, to make the pupil a very specific size. How does that deliver near vision?
So that's great. And so we are learning, or we learned that if we get that pupil, that optimal 2 to 3 millimeters, that's going to give that optimal pinhole effect to allow the patient to be able to see clearly, but not disrupt their distance vision, right? So if the pupil gets too small, in some cases where we maybe get below 2 millimeters, we're thinking more of some diffraction, some blurriness there. And of course, we know from optics classes, if the pupil gets too big, then you have aberration. So about 2 to 3 millimeters is a good spot to be, which Qlosi does very well to get the pupil there and to maintain clear vision without disrupting the distance vision as well.
So the third word in this title was customization. How does that play into the way that we tell a patient to use this product? Do they have to use it every day? Do they use it certain days? What have you found to be the best strategy to really make this impactful for patients?
So I use the word flexibility. So the Qlosi formulation allows the patient to be flexible. And it really helps me to be able to get into that space with the patient because I'm legit, like it was like I fell off a cliff this birthday. And so flexibility is important, which I use it in a flexible way. And so the beauty about it is you can take it every day, twice a day. Typically the dosage can be twice a day, first drop, and then 2 to 3 hours later, take the second drop. But if a patient doesn't need that extended effect for the entire day, they can do 1 drop. So personally, I take 1 drop because that drop gets me through the bulk of my clinic day where I'm doing a lot of back and forth with the computer and the phone, and it allows me to see comfortably. And I tell my patients, if that works for you, great. If not, if you know how your day needs you to be able to still have that ability to have the intermediate and near and interchange pretty easily, then you make sure you get that second dose in. You can do as long as it's within 2 to 3 hours after you took the first dose. So customization, but flexibility is the key. I believe the more options we have, the more flexibility we have in this presbyopic space, the less frustrated we will be.
So I actually prescribed Qlosi to a patient yesterday, and I'm still trying to navigate, who are the best patients for this. And I'm trying to develop the best phrases to open this door to patients, because even though this has been on the market for months now, most of my patients are completely unaware that this is even an option for them. So are there certain patients that you look for that you think are going to be the most successful, and how do you bring this up to them?
And so that's a great question. I'm navigating that space still with Qlosi, but a couple of things I recommend to my peers, which I did previously with another drop that came to the market, is put in the paperwork. A lot of times that take a lot of the elephant out of the room, trying to figure out who is interested, because you may try to get an avatar and you see, oh, that patient is the one that's definitely going to want this drop, and they'll say, no, I'm not interested. And there's a whole bulk of other patients that may be totally interested in this drop, but just get so focused on one patient. So 1, put in the paperwork. They can opt in. And then 2, when you're doing the history, whether it's you or your technician, just got to ask some probing questions. What do you use your glasses for? I don't make any assumption. If I see that prescription or your contacts, what do you use them for? If the patient says, I really only use them to read, looking at their prescription, whether they have a progressive or not, they use those glasses primarily to read, to work at the computer. And that's when I started to say, well, if you had some other options, if I was able to prescribe a drop for you that allowed you to reduce your dependency on having to use those glasses, right? That's the key word, reduce your dependency. So we don't want to set it up as if they are just done. No more glasses ever through the rest of presbyopia. No, because it really depends on the patient demand, their goals, their day, what they have to do. So my key words, what if I can reduce your dependency on needing the reading glasses, or reduce your dependency on using your contact lenses? Because I still prescribe all of the things. I think it's important. for the patient to have flexibility and options. And so go ahead.
So let's say you prescribe it today. So the patient's excited about it. They go through the ordering process. They get it in their hands. How do you prep them next? So like with presbyopia, well, really forever, whenever we prescribe glasses and progressive lenses and the patient complains about vision, we say, well, you just haven't given enough time to adapt to this. Same with multifocal contacts. Is there any adaptation to Qlosi that you prep your patients for? And then are there any side effects that you give that you put in their frontal lobe just so they're not surprised by anything?
Yeah, that's great. It's important to tee up expectations and help the patient understand what they should expect at home. Typically, when I prescribe, I let them know you can be flexible with this drop, but the first week, I do want you to take 2 drops per day, 2 to 3 hours apart, and that's because that's going to allow your brain to adapt how you're seeing the world a little bit differently through this drop. And so we know that as neuroadaptation, there's some clinical data that's shown with Qlosi far as binocular summation and adapting to this drop over that week period, that it helps the patient to see clearer and clearer. And so I tell the patient to use a one drop twice a day, 2 to 3 hours apart for at least a week. And then once you kind of adapt to this medication, how it's working, what you feel comfortable seeing, then after that, if you don't want to use it every day, twice a day, you don't have to. That's the beauty of it. You have that flexibility piece. Then I do talk about the adverse events a little bit. I say, we do expect if you put this in, you may experience a little bit of stinging. If you do, that's normal. It doesn't last too long. Also, you may notice a little change in your vision, a slight dimming effect. And if you do, that's normal as well. That tends to improve as you continue to use the medication and part of that neuroadaptation. And then depending on the prescription with the patient, I do let them know that you do need to get a routine regular exam. So I make sure I dilate every patient. This is not something that we prescribe without, you can take a picture, but I definitely encourage you to make sure you do a retinal exam. And however you do your thorough comprehensive retinal exam, personally, I dilate the patient. So this is something that's happening during or after their routine exam. And then I let them know that we need to monitor their retina and their overall eye health anytime we prescribe anything, and so that they need to come back. So you decide what system you want them to come back in, whether it's once a year, in 6 months, how you want to set that up depending on the patient.
So I did read the clinical pivotals that brought Qlosi to market after approval by the FDA, and I found that there were some very modest, very mild reports of brow ache or headache and installation site issues. I think headache was around just under 7% of incidence, and installation with the eye drop, specifically as it goes in, a little bit of pain there, just under 6%. Are you seeing those? Are you prepping your patients for those?
I still prep them because, it's a study and there's a certain percentage, as you mentioned. So on a broad scale, you may prescribe a lot and then someone mentions those things. So I just kind of blanket tell everybody. So
Okay.
That way, if they experience that, they know, okay, Dr. Davison said that I might experience this. And if I do, it should improve. And of course, it's not let them know what to do, how to contact you. We do a lot of two-way texting in our office. And I always say, just text us if you need some further clarification, or if you're experiencing something that you're like, hey, I can't remember if you said this is something I should experience. But that's a good call out. Those adverse events are there, but those that is lower than the previous miotic that came out, and that's because the concentration is a lot lower.
Yeah, you mentioned like the neuroadaptation. If it exists, it's pretty fast resolving, as are these side effects. And sometimes when you employ things in real life, that's different from research studies. And at least I've not had a major issue with headaches per se. I've had a little bit issues with site irritation upon installation, but it's very tolerable. I haven't had any patients balk and say, well, I don't want to use this anymore because of this. So that just tells me that it's delivering. And if there were any issues, they resolve fairly quickly.
Yeah, I agree. Same thing as a patient that uses it myself. I didn't have much of the brow ache at all, but some of the installation site stinging, but it's never been enough that make me want to discontinue the medication. So that's an important call out.
Yeah, I didn't tell you before, Janelle, but I'm a user too. I put my first thing this morning. There's one question in the market of ECPs that we haven't touched on yet, but I think critically important to practitioners, and that is, so with now a pharmaceutical intervention for presbyopia through depth of focus and very purposeful pupil size, we're improving your vision, and you You mentioned that in detail. How does this impact glasses and contacts? Do I need to give my patients a prescription without an ad, with a different prescription, or can they use what you've already prescribed them in concert and in combination with or without Qlosi? Because that would then make my work more if I have to do something extra.
No, the way I've incorporated in clinic, it's not a or, it's an and, right?
Got
So they're coming in for their comprehensive annual eye exam, and you're already going to be assessing them for if they need spectacle correction, whether they want to do contact lenses, and now I add this. So routinely when I do prescribe this, and it's not something you may necessarily prescribe it every single day. It really depends on your patient base. But when I do is say, hey, I'm going to prescribe you progressive lenses, reading glasses, whatever we decide is the best option for that patient, and sometimes both. You're interested in contact lenses, we've done your contact lens exam as well, finalize that. And I'm also going to prescribe a therapeutic option, because the key word is flexibility, options for less frustration, because there'll be days where you may not want to do the glasses, you want to do Qlosi, or you want to put your contact lenses on. The more tools you have in your tool chest for the provider as well as the patient, the happier they are, because you're giving them options, and they're going to also go tell their family members and friends. Now, one thing I do say, when I prescribe this, I said you cannot share this with your wife, your spouse, your partner, because they have to make sure that their eyes are healthy enough for this medication. And so you want to make sure they come in. So I do make sure I add that, because people will share, and you don't want a spouse or a partner sharing this with their -10 partner at home. So I do indicate, do not share this medication, because everybody's going to want to know, wow, how are you doing this without glasses or contact lenses? What is this drop? Don't share, send them on in.
I love that call out, Janelle. That's critically important, and something that's honestly easy for us to forget. We think that we're talking just to the patient in the chair, but when they go home, who knows what they're doing. And I am all on board with what you said before about, getting my eyes on the retina. I want to be able to view that. I know that there are high quality cameras out there, and I've got high quality cameras, but I know I've got a big brow, and my camera can never fully image my superior retina, for example. Even the inferior is not optimal. And yet, dilation does not take a lot of time.
For me, it doesn't.
View to make sure that we're not seeing areas of suspect retinal thinning, tears, etc., that could potentially pose a challenge. But when the patient has a clear fundus and the refractive error makes sense for a treatment like this, and they're excited about a treatment like this, let me just flip the question. Why wouldn't I prescribe this? Why wouldn't you prescribe this to the masses who fit those characteristics?
I agree, especially if the patient is asking, they are healthy enough for this medication, and you are looking to grow your practice, right? It's all about loyalty, meeting the patients where they are, meeting their needs. And it's important, I built my practice from the ground up. And so I've been standing for 15 years, right? And so you have to stay on top of innovation. You have to meet patients where they are. And as a clinician, as long as you know what we need to look for, if they fit in this box. And then when you mentioned looking at the retina and potentially any thinning, that's with any miotic. Now that we are in this space, whether it's pilocarpine based or not, if it is changing or making the pupil size smaller, there's a potential there could be some retinal changes. So you just want to get your eyes on the retina and just figure out how you're going to do that most efficiently in practice. Personally, I always dilate new patients, especially if they're going to opt to something like this, then it's a requirement to get dilated. For me, add on pictures and great stuff like that, whatever you want to do, but get your eyes on that retina and let the patient know that anyone else in their family that they're mentioning this to, they need to have someone look at their retina as well before they start using this medication.
So this is still relatively new for us. I hate it when I find out that my patients learned about something new from somebody else and I didn't do it. But we're relying on our memory and habits. And I think the authors usually say it takes 30 times in succession in a row to create a habit. Well, this is new. Sometimes it's hard to remember that a pharmacologic treatment for presbyopia exists. And so I'm really trying my best to every single patient, even if it's not for them. They can then tell their friends and their family, hey, guess what I heard? My doc said it wasn't for me, or maybe he said it was for me. But this is new and exciting. And so I would say one of the barriers that we have out there amongst all ECPs is just remembering that this is a new option to bring up to the patient.
I agree. And that's why I say, make some kind of accountability, add it to the paperwork. When that's done, a lot of the things that I want to make sure that we're all honing in on, and I'm not using our own biases, is put in the paperwork. You'll be surprised how people start to opt into certain things that they want to learn more. And that gives you an opportunity to quickly say you're a candidate, you're not a candidate, and decide if it's an add-on to your routine exam, or if you're going to bring that patient back for a specific presbyopic exam. Those are the things that you want to kind of look in for the admin portion, how it's going to work in your patient flow. But that's one, paperwork. And then two, start talking about presbyopia early, right?
Yeah.
And so I talk about it with my 20-year-olds. When they come in for the annual exams, I like to give a roadmap of what to expect as you continue to live. So the 20s, 30s, 40s, 50s. And so I kind of started to put those things in their mind at the forefront. So one, when it happens, they know to come to me and not necessarily go self-prescribe over the counter, but they know there's options available. And then if they're 20, guess what their parents are? Probably late 40s, early 50s, and they can say, I'm not a candidate for that. But guess what? This is what Dr. Davison told me about. Mom, Dad, you need to go and get an exam because there's something for you as well, instead of maybe some of those progressives.
So let me describe a few patient types, and you tell me which ones you think are good candidates, just so everybody hears your perspective. So, low myopia, moderate myopia, emmetropia, a little low to moderate hyperopia, a post-refractive surgery. Which of these patient groups might, assuming everything else is normal and perfect, would be good candidates to use Qlosi?
Well, all of them, technically, based on the data. So you can do your post-refractive candidates, your IOL patients who are maybe not getting those outcomes they anticipated for intermediate and near. I have a lot of colleagues that are using in that space. Post-LASIK, provided you kind of know how myopic they were before LASIK. I took that boat. I'm post-LASIK, and so I was very adamant about not getting back into glasses as long as I could. Your low myopes, your moderate, up to about 450-ish. Your patients who wear contact lenses, who have that little bit of a gap, and they don't necessarily put reading glasses on top. This is an option. Your emmetropes, for sure. Your emerging presbyopes, and sometimes you got to be careful with them. They have to kind of be in the field for a little bit, because sometimes they'll start and it's a little bit, they're okay, they can make out most things, and you'll think they'll be a slam dunk, and usually they're like, oh, I'll wait it out. But your early emerging presbyopes, your emmetropes, your low myopes, it's a gamut. So I like the fact that there is options available, so that way you can dip your toe. You can pick one avatar that maybe you're at Target this week, and next week target another, so that way you can really see in your clinical practice where you think this is the best fit. But we have a good wide range of patients that we can try this medication on.
Excellent. Well, before we go to the next question, we're going to pause for a moment to show a video on Qlosi.
Hun, seeing an eye doctor today.
Huh?
Eye doctor, Qlosi, near vision.
I don't need an eye doctor. I've got readers, if I could find them.
If you can find them.
Just give me a second. I'm just trying to find the... Guys, can you see my screen? Guys?
Qlosi is an eye drop that helps you see up close like you used to. Stop struggling to read text or labels.
Oh, hon, can't see again.
Qlosi, man, come on. It's time. You gotta ask your eye doctor for Qlosi.
Qlosi is an eye drop that helps you see up close like you used to. Do not use Qlosi if you are allergic to any of the ingredients. The most common side effects are burning or sting and headaches. Use caution in night driving and other hazardous occasions in poor light. Enjoy clear, near vision when you need it. Ask your eye doctor for Qlosi.
So Dr. Davison, in terms of getting the message out about this and building excitement, I have seen that Qlosi has a nice position in social media with actually really good information there. But I've also heard from other practices that use other things, point of sale material, pamphlets and posters, just so that patients see that and they may bring it up if we forget to. Have you employed any of those strategies in your practice?
Yes, not so much with the social media, but I do have the posters on the back of my door, which have worked really well. So it was a great call out for me one day when I was slipping and I didn't bring it up. A patient said, well, what about that on the back of the door? And I said, oh, wow. So back of the door clings, those are great. And also they have these really cool things that are called a see and savor. And so it's a way to introduce Qlosi to your patient base and to the community. And so I think you can talk to, if you have a rep about that, how do you get one of those going in your office? But they do have some cool things available.
One of the things I found, and I imagine you do this as well, is if there's something that I'm using as the patient, even though I'm the provider, I think that's really impactful for patients because the presumption is I know all the options. And if I'm choosing to use it myself, that just lends a lot of credence to the belief that I have in the treatment, or in this case, in the treatment, and which is a product. Do you think your patients feel the same way?
Yes. And so even if it's not you, anytime that you can humanize what you are prescribing for your patients. So before I became presbyopic, I would lean on parents, grandparents, family members, and friends. I think that's what brings the humanity to your chairside manner. So anytime you can humanize, because I don't want to discourage some of our Gen Zers who are far away from presbyopia, enjoy your youth, but just find a way to humanize whatever you're prescribing, whether it's a family member, a friend, or pulling something out of the data, or even another patient that you work with, of course, not saying that patient's name or information, but yes, anytime that you as the provider can really kind of show that this is working at a real level beyond the studies, patients really appreciate that.
Yeah. So as we come to a close here, there's a number of doctors who have been prescribing Qlosi, but there's a lot who haven't tried it yet and who are eager to get started. So what are some words of wisdom that you might have to motivate somebody to get started as soon as possible?
I would say it's easy. One thing that keeps me abreast of innovation is, like you stated earlier, I never want my patient out to learn about something that they just had an eye exam and I didn't bring it up, whether they're interested in it or not. So if you have patients that are over 40, let's say start with your 45 and up. Before you go in the exam room, if you have information that lets you know that patient's age, if there's some history that you can look at, some of their hobbies, walk in the room and say, I'm going to prescribe the glasses and contact lenses, but I also have another sighting opportunity available to help reduce your dependency or give you a break from your reading glasses. And a lot of times I tee it up before I even start the whole exam. Then I'll say, well, let me go through the exam. I'll make sure everything is healthy and then just confirm you're a candidate, right? And so just start. It's okay. Don't be afraid of innovation. This is an awesome time. I'm so excited to be a presbyope in this day and age where we have options available. Right now I'm using Qlosi, but there's going to be so many options available. And I think this is a really good time to have this space and to be at the forefront of that as a clinician.
Yeah, I like that. I think that would definitely motivate me. Depth of focus is a funny thing. I do try to tell my patients that this medication is not going to magnify letters like your spectacles do. And so the best way I can describe it, and this is really how I feel as a user, is it makes my eyes feel more like they were 35-year-old eyes again and not 55-year-old eyes. And so that's not a drop in the bucket. That's pretty significant when you can actually do something to make you feel younger again and not have to feel so dependent and be reminded of your presbyopia all day long, given the amount of near work we do. I think that there's a lot of power there and potentially a lot of quality of life things.
I definitely agree. The first sign of aging for me was when I couldn't see up close. No matter how many sunspots or wrinkles I may find on my face or gray hair, it was till I could not see up close that I was like, oh my God. So for a lot of patients, it's the first sign of aging. So to have some options, specifically therapeutic options, specifically Qlosi available for patients, I think this is a great time.
Yeah. So we have a product that's performing. We have a product that's easy. It's convenient. And as you said, it's flexible and customizable that the patient can use it as they wish. To me, that's a win-win-win across all boards.
I agree.
You've been a wonderful guest, Dr. Davison. I'd love to chat with you again. And hopefully everybody out there listening, get on board and talk to your patients about this new pharmacologic treatment for presbyopia, Qlosi.
Class has ended for today, and we have no exams or grades approaching. Please email me at foureyeedprofessor@gmail.com if there are topics that you would like to hear and see through a professor's eyes.
Indication and usage. Qlosi, pilocarpine hydrochloride ophthalmic solution. 0.4% for topical ophthalmic use is a cholinergic receptor agonist indicated for the treatment of presbyopia in adults. Important safety information, contraindications, hypersensitivity, warnings and precautions. Advise patients to not drive or operate machinery if vision is not clear. Example, blurred vision. Exercise caution in night driving and other hazardous occupations and poor illumination. Rare cases of retinal detachment have been reported with miotics. Examination of the retina is advised in all patients prior to initiation of therapy. Advise patients to seek immediate medical care when sudden onset of flashes of light, floaters, or vision loss. Qlosi is not recommended to be used when iritis is present. Qlosi should not be administered while wearing contact lenses. Remove lenses prior to installation of Qlosi and wait 10 minutes before reinsertion. Avoid touching the tip of the vial to the eye or any other surface. Adverse reactions. The most common adverse reactions, 5% to 8%, are installation site pain and headaches. Please see full prescribing information here. Qlosi.com/prescribing-information.
Hey family, if you enjoyed this full podcast, don't miss out on more engaging content. Check out the next episode right here. And for the latest updates, hit that subscribe button and ring the notification bell. Your support means the world to us. Catch us in the next episode. Peace.